Okay, so what I want to talk to you today about is the single most common problem I see causing lower back injuries. I've seen this literally hundreds of times over the last 17 years, and here's where it comes from. Your spine has natural curves in it. You have a curve in your lower back and your neck. That's called a lordosis. Curve in the middle of your back around your shoulder blades, that's called a kyphosis. Those are supposed to be there. When patients get into trouble in the lower back, time after time, it's because they do not keep the lordosis in the lower back. You gotta keep this curve in your lower back. You cannot have good posture if you don't keep that lordosis there. So a little trick we do is we use a wooden dowel. You should be able to put this along your spine, and it should touch in 3 spots. Okay, when you pull it away and you stand up, that's how normal posture should feel. Okay, that's normal. If you can't do that, we have stuff to work on with you. Alright? So what you need to practice if you're having trouble with your back is bending and keeping that curve, that lordosis, in your lower back. You should be able to bend and maintain that. We call that a hip hinge. When you bend, all of the hinging is happening here, not in your back. So what happens? You wake up in the morning and your back's stiff. What do? You bend over to put on your socks. You go to the bathroom, you bend over to wash your face. What do? You lose the lordosis in your back. You feel a twinge and your back blows up. So you got to practice bending. You really kind of have to stick your butt out when you bend, and it's hinging all at the hips. One way to practice that, go next to a wall, practice touching your butt to the wall when you bend. You got to practice that. If you don't keep that curve in your spine, #1 cause of lower back injuries.